Good on your lunch hour. Sponsored by the Advanced Cosmetic Surgery and Laser Center.
Good afternoon once again, and look good on your lunch hour. It's the hottest product to help you look younger. They're called dermal fillers, but do they raise the risk for certain types of cancer? Joining us now to explain how these work, Dr. Jon Mendelsohn. He's a facial plastic surgeon at the Advanced Cosmetic Surgery and Laser Center. Good afternoon to you. I know this is quite controversial, and it seems there may be a connection, not directly, but with the immune system. What can you tell us?
Yeah, well, I'll tell you what you're reporting on, which is a reputable doctor plastic surgeon who is concerned about utilizing what we call hyaluronic acid fillers, or frankly, any fillers that could disrupt the lymphatic system. And the claim is, could this lead to some sort of carcinoma or cancer? So let me just state a couple of things. First of all, I'm a facial plastic surgeon. I don't have any allegiance to any pharma company, so I'm speaking for myself. There are no documented, there's no documented cases. There's no documented research to suggest this. Perhaps if somebody had a head and neck cancer, then the lymphatic system, which is responsible for with our white blood cells sort of playing a surveillance game, perhaps there's something that could be possible as this claim suggests. We use such small volumes of this that even if there's a lymphatic change, it's highly unlikely that this is going to be a causative agent for cancer. There are certainly some other issues that hyaluronic acids and injectable fillers raise. The biggest is probably everybody's an injector. The facial anatomy is quite complex. There are intricate anatomic details that should be adhered to, and so you do want to make sure that you're going somewhere with a reputable, reputation. The other thing is, don't inject yourself. About 15 years ago, we had somebody literally, you watch a YouTube video. We've got some Google doctors in our family, and so the next thing you know how to do it. So you order something from the internet, and literally, she injected cement into her lips. So she came here, and we managed her complications and problems from that. But there are so many benefits to these injectable fillers, as we've talked about over the years. This definitely has people talking. I would say the biggest issue is if you go to a place like LA and you're standing in Starbucks and you see people with overfilled faces and cheeks, lips. That's probably something that most people don't agree with.
Yeah, we have a little video of your team, and I know you really go for the natural look, which is nice to see. So I guess the reason that we should talk about this is, as you mentioned, people on social media are mentioning it. So what is your final thought about this potential cancer connection?
Yeah, so my personal view is that there's no connection to cancer based on utilizing these hyaluronic injectables, period.
Excellent.
That's my assessment. What I do suggest is that you go somewhere reputable where you know the products that are being injected. I'm not suggesting that maybe there's a lymphatic change. There are things we do with surgery. This gentleman is saying, go have a facelift rather than fillers. I'm a facial plastic surgeon. That would be great. But I think that they complement each other, and I don't think this is going to change the direction of how we use these products in cosmetic.
Excellent. We always appreciate your voice of reason. 513-351-3223 is the Advanced Cosmetic Surgery and Laser Center if you have questions. Dr. Jon, thanks for hanging out with us today.
Thank you, Liz. Have a great day.
You too.